Okay, true or false? All acne is hormonal. Give up? That is true. Yes, believe it or not, no matter how old you are, whether you are a newborn, a teenager, a 35-year-old woman, or a 70-year-old individual, all acne has a hormonal component that is driving the increased sebum, the increased oil production. And so, in effect, all acne is hormonal. I'm Dr. Mina, board-certified dermatologist and host of the Skin Real podcast. Welcome to my channel where I take an unhyped, factual approach to skincare education and guidance. And I'm doing a recap today on a recent podcast episode I did with Dr. John Barbieri. He is a board-certified dermatologist, acne expert at Brigham and Women's Hospital in Boston. And on this recent episode, he shared some amazing insight into the pathophysiology of acne, treatments, whether food is contributing to acne or not. And if you are interested in listening to the full podcast episode, I'd encourage you to do so, and I will link it at the end of this video. Okay, so let's break down what is acne. Acne is basically an inflammatory and chronic condition of the pilosebaceous unit. And that is just a fancy way of saying your hair follicles and your oil glands, because they connect together and empty onto the surface of the skin together as a unit. So what happens is something triggers your oil glands, your sebaceous glands, to start producing oil and to even overproduce oil. Now, a lot of things can do this. A lot of the time, the main driver are your hormones. So you have overproduction of oil, and guess what? That oil becomes sticky. It binds to our skin cells. It binds to dirt and debris on our skin, and it basically forms a plug in that pilosebaceous unit. So now nothing can escape and nothing can get out. And that is known as a comedone. Sometimes they are open and they are usually have a dark spot in the center from oxidation of the oil, and that is known as a blackhead. I'm sure everyone is familiar with those. You can get them around your nose, you can get them on your chin, but that is a blackhead. And then when it's closed over, that is a closed comedone or a whitehead. And that's kind of the root lesion of acne. So and then what happens, you've got that plug there blocking. It's going to trigger an immune response in your body. So now you've got that plug in your follicle. And guess what? Certain bacteria on our skin, known as C. acne, certain strains of C. acne, they love sebum. This is like food for them. And so they are overproduced. They are drawn to the sebum, and that stimulates an immune response within your body. So now you've got a revved up immune system. You've got increased levels of C. acne in your skin, and you've got these comedones. And what can happen is you get increased inflammation under the skin, and those acne lesions can become red. They can form little whiteheads and drain, and they can even form really painful nodules and cysts that feel like they're deep under the skin. So that, my friends, is acne. And if you're like me, you have experienced all different levels and stages of those acne lesions. And then a lot of times once the acne lesion is gone and resolved, you are left with either some post-inflammatory erythema or pinkness on the skin, or post-inflammatory hyperpigmentation, which is a dark discoloration on the skin. And a lot of times this will last weeks or months after the acne lesion has gone. And so for many people, the acne is not even that bad. It's the sequela, it's the problems that happen afterwards, like the darkness or the scarring, that can be more psychologically traumatizing for people. So acne, it happens at all ages, all stages of life, typically hormonally derived or driven. So let's also just briefly talk about food. So there are a lot of things that can trigger acne. Food is one of them. And the biggest association with foods causing acne would be eating a diet with a high glycemic index. So think about eating basically refined sugar that you add to things. So junk food, processed food, these are all going to have high sugars, high glycemic index. So one of the things you can do if you are struggling with acne is try to cut back on the amount of refined sugars that you're eating to see if this helps. There have been some studies suggesting that milk or dairy products can also trigger a worsening of your acne, specifically skim milk. And that there's a little bit more mixed data on that, but certainly it's something to try. If you are drinking a ton of skim milk and your acne is flaring, try to cut back on that. And then, of course, things like whey protein, that is like drinking gallons of milk, and studies have shown that that can worsen acne as well. But eating a pizza or pepperoni, not necessarily. It's really those refined sugars you got to monitor for. I love how Dr. Barbieri broke down a lot of the treatment options for acne. And let's just start with the basics. If you have pretty mild acne, you don't really need to see a dermatologist. What can you do with over-the-counter products? Well, first thing you want to do is use a variety of topical therapies. So I love using an over-the-counter retinol like adapalene to help combat that root cause of acne, that comedone. It's going to help open it up. And you can get some purging in the beginning, some dryness and irritation, but that's a great product to get on if you do have blackheads or comedones and maybe mild acne. You can also mix it up with a benzoyl peroxide wash or spot treatment. This can be great for those more red inflamed acne lesions. Also, a lot of blackheads, you can use a salicylic acid wash. And then if you're getting more dark spots on the skin, you can look at things more like glycolic acids or alpha hydroxy acids as well. But just be careful. The goal here is not to scrub your skin so hard that you scrub all the acne off. That is what I tried to do in the 90s with my St. Ives apricot scrub. You actually do not want to physically be debriding your skin and really damaging your skin barrier. Let the medicines do the work. So just be mindful not to over scrub or over pick your skin. One of the things that I'm loving that they have now for acne are these little hydrocolloid patches. I love these things. It's a great thing to put on a red inflamed acne lesion. It's going to help dry it up, and it's also going to keep your hands off of it, your hands from picking, because as tempting as it is, if you pick your acne lesions, you are going to be more prone to scarring. Now, moving beyond the topicals, now your acne is bad enough, you really need to see a dermatologist. Back in the day, and even still today, a lot of dermatologists will prescribe oral antibiotics. And it's not always a bad choice, but there are better choices out there. And oral antibiotics have a ton of side effects that we don't even really realize or recognize because we use them all the time. But typically, using an oral antibiotic for a non-infectious chronic skin condition is not necessarily the best choice long term. It might be good for short bursts to kind of calm it down, but there are other options that we can use. I love for women my age, 30s and 40s, with what we classically call hormonal acne, is to use something like spironolactone. This medication has been around forever, and as the years and decades go by, we realize how safe and efficacious it is and how it can really be used in healthy individuals very well. It works well and it's tolerated well. So that's a great option for someone with acne. Oral contraceptives, or combined contraceptives, I should say, can also be really helpful for women struggling with acne. And there's now a topical anti-androgen cream known as clascoterone, which is a great option for people who really want to avoid systemic therapies. And this medication can actually have the anti-androgen benefits that some of these oral ones have, but it's applied topically and there's minimal systemic absorption or side effects, I should say. Of course, the big gun of acne therapy is isotretinoin. And we talk a lot about this in the podcast. So I'm just going to say here briefly that it is a very effective drug for acne. Not only can it treat acne, it can actually put it into remission and kind of cure it. So if you have severe acne and other things are not working, this medication is really, really powerful. There are side effects, and the most common is that it does cause your lips, your skin to be dry. And so typically this improves once you stop it, and also you can lower the dose. Sometimes people can get muscle aches. Those are the most common. Through the years, we've now realized we don't really need to do the excessive blood monitoring that we did in the past. But one thing that is absolutely non-negotiable if you're taking isotretinoin, you cannot get pregnant. It will cause birth defects, very severe birth defects in your child. And we also don't recommend that you donate blood when you're on this medication. So yes, there are severe birth defects that are associated with isotretinoin in women who become pregnant. So that is really an absolute contraindication. But the good news is all these other side effects that we've heard about before, suicide ideation, inflammatory bowel disease, these other conditions, depression, it seems to not be borne out. And in fact, people who are on isotretinoin for their acne tend to have less depression and happier moods, ultimately because it is so effective in treating or curing someone's acne. So if your acne is severe, be sure to see your board-certified dermatologist because isotretinoin may be something to consider or at least learn more about. Even cooler, there's now a laser or two lasers that target the sebaceous glands in particular. And this is a great option for people who, again, are not wanting to do systemic therapy. They don't want the blood monitoring or they're trying to get pregnant. And this laser requires multiple treatments. It's probably not as effective as isotretinoin. Nonetheless, it is an effective modality for acne. And I just think a really cool use of laser light therapy in targeting a medical condition. I would say the biggest negative about this is that insurance does not cover it. And so you do have to pay out of pocket for that. So my key takeaways from my episode with Dr. Barbieri are that acne is hormonal. Really, all acne is hormonal. And coming at it from a multi-pronged approach is really going to give people the best chance of cure or remission of their acne. So making sure we are coming at it from lots of different angles with lots of different therapeutics can be super impactful and helpful. And I would encourage someone who is getting acne and starting to notice even some scarring or hyperpigmentation to see your dermatologist because we want to be able to slow down the acne before it progresses or gets worse because it is very difficult and very challenging to treat that acne scarring once it is there. There are so many options out there nowadays from over-the-counters, topicals, even potentially supplements to laser therapy that can help with your acne. So definitely see your dermatologist if your acne is affecting how you feel about yourself and your confidence. It is not just a cosmetic condition. This is a real condition that affects not just your skin, but your mental health and your socioeconomic situation. So if you are interested in learning more about acne, be sure to check out my episode with Dr. Barbieri right here. And of course, you can check out some of my other podcast episodes talking about acne and some of my YouTube videos.